So that was Boris Johnson yesterday making the case for that strategy to ride out Omicron. And the ambition is that as more people get infected, but the infections have less severe, milder symptoms, we could move from an epidemic through this pandemic into a situation where coronavirus, COVID-19 is endemic. It's everywhere. But our hospitals are not as threatened as they would have been at the beginning of the pandemic. Do you think that is the right policy? Live with this new variant of the virus and ride it out? Or should Northern Ireland stick with its stricter restrictions, possibly bring in more restrictions to protect more people and the health service as it stands right now? We are joined by the business woman and Conservative member Felicity Huston, who very much supports the Boris Johnson strategy as it was outlined there, and Dr Frances O'Hagan, the GP Frances O'Hagan. Welcome to both of you. Good afternoon. Frances, let me come to you first of all. Given what we've just said, given what Boris Johnson has just said, do you think we should start easing up on restrictions?
I think it's just a little bit premature to ease up. We've had probably more sensible measures in place here in Northern Ireland, measures that work. For example, wearing masks in public spaces, trying to keep your distance and to, use your hand sanitizers. These things work in stopping spread if we stick to them. And as well as that then, we have a high rate of people boosted here in Northern Ireland, especially our older population. And the question is that what is helping reduce the severity of the Omicron, because we have so many, people who are vulnerable, who are boosted. So I would still have a plea out to people to say, do the sensible things, but also, if you're not boosted, get boosted. Because while we're saying that this is, looks to be milder, that's really translating into less deaths. Our hospitals are still full and the numbers going into hospitals are rising. If you've had this yourself, to say that it's mild, some people get lucky, but there's quite a few people are finding that they're really unwell for a few days. And what that is meaning in our huge number, like 50,000 in the last week, that is taking people out of our care industry, out of our hospitals, out of our primary care, but out of our shops and our services as well. If this continues to rise...
But isn't it principally taking... sorry to break in, Frances, but when you say it's taking people out, what you mean is people are self-isolating?
Yes, appropriately so. So. But they're not available to go and do their day job. So, we may find that certain aspects of our community, be it in business, be it in your health service or whatever, have a vastly reduced service because there's so much Omicron that the staff are out and we can't provide the same service that we were able to provide on a normal working day because we just don't have the bodies there to do it.
How do you see it, Felicity? Welcome.
Oh, hi. Well, I'm very pleased to hear that people seem to be optimistic. I mean, I actually said to my husband this morning when I saw a headline in the Belfast Telegraph, Tom Black, optimistic, in the same sentence, I said, my goodness me, things really must be getting better. And I thought that was a very good sign if Tom, who has always, or shall we say, recommended great caution, is optimistic. I thought that was a great possibility for us all.
Well, to be fair to Tom Black and others who are expressing optimism today, who were calling for restrictions in the past, they are matching their response to the data as they see it right now, and the data changes over time.
Did you not say, Will, that we had astronomical cases in the past few days? I mean, I know, being an accountant, I know you can do anything with numbers, and of course the figures are a bit strange because of the holidays, but I thought you'd said we had huge figures.
We do have huge figures.
Yeah, exactly. So, but they're still optimistic.
They're optimistic really because the level of severity is less and the impact on hospitalisation is less. So, for example, out of over 3,000 hospital beds, we have 348 currently given over to COVID. We have just over 30. We've just over 30 in ICU beds out of 90 to 100 or so that we have available to us. So that is the measure of optimism related to the data.
I'm sure you heard the NHS guy. The guy was at there's so many NHS organisations saying that we have to distinguish now between with COVID and from COVID.
People have been saying that since the beginning.
More and more people will be brought into hospital carrying COVID, but that's not necessarily what they're being treated for. So it is, in England, they're certainly accepting it is important to differentiate from all that. No, I was just meaning that genuinely it is a good sign. Next we'll have a picture of Robin Swan smiling. And I mean, we really will know things are better. It may sound slightly sarcastic, but it is also a genuine sign when those who have appeared regularly warning of the dangers are now starting to say they think things are getting better.
I think this is unfair, Felicity. I think this is unfair because the assumption at the core of what you're saying is whatever your policy is in a pandemic has to remain your policy to the very end. That's never been the case with pandemics. You change your policy over time, and at the end, as the pandemic tamps down, you lift restrictions. That's what you do in pandemics.
Yes, exactly. But I mean, we were told by Sir Michael this time last year that there would be restrictions right through to spring 22. We've been all trying to live our lives around all these things. It is a good sign, and surely you would agree. If, for example,
I dare say there probably will still be
known
restrictions to spring 22.
Yeah, but I mean, that was over a year ago. Well, about a year ago, he said that. That was quite a surprise.
Turns out he was right.
Well, there's all sorts of theories about that, but exactly so. But I'm actually trying to say that shouldn't we be pleased that he, as long as a great many national experts and even international experts are saying that things are looking good. They're hopeful, and I think, we have to give people hope. We have enough mental illness problems in this country as it is, and further afield, without making people even more depressed for the future. We have to remember that side of life too.
I guess where you're both on the same page here, Felicity Huston and Dr Frances O'Hagan, is that you both believe that the vaccination programme plus the booster programme is absolutely key to moving us through Omicron as it was with the other variants, and that is a very hopeful thing. Beyond that, we will, and we'll be talking about this later, the development of antivirals, more and more coming on stream in America and across Europe. That will be daily pill treatments for people who have symptoms, thereby hopefully protecting those people from the need to go into hospital. Given all of that, are you optimistic this year, at the beginning of this year, Frances?
Yes, I mean, I would agree with all the international experts that, yes, I am optimistic for the year going forward. What I'm trying to caution about is saying we throw the baby out with the bathwater right now, because we had 50,000 cases in the last week, and we are on a trajectory to have something similar this week and next week is what is predicted. So what I'm saying is, whilst I'm optimistic going forward, I still feel that people need to be cautious right now. They still need to get their booster. They still need to wear their mask. They still need to, use their sanitisers and space and have sensible, measures. It's not about saying, oh, great, everything's over. It's all done and dusted now, because the numbers are just so high at the minute of people actually catching it and those people having to stay at home and rightly self-isolate. That is having a direct effect on our economy and on our health service and the services we can provide right at this minute. So whilst, yes, I am optimistic, I'm still saying we need to be cautious just right at this moment in time, because the numbers are so high.
Just a few days ago, I'll remind people, the Director General of the World Health Organization, Dr. Tedros, said, as we enter the third year of this pandemic, I am confident that this will be the year we end it, but only if we do it together. He's talking about the global significance here of a pandemic. A pandemic is a global epidemic, so we're not over it until we're all over it, is the point he's making. But he's absolutely confident, he says, that this will be the year. We've got the medicines, we've got the vaccines, we've got the antivirals coming on stream. He believes we can do it this year.
That's optimistic outlook.
Gareth, the executive, of course, meets, and the executive is reviewing the policy, and it'll be for the executive to set any restriction changes in place. What would be helpful about bringing the Assembly back a week earlier?
Well, I think it just shows that people are in charge. It's not that.
But the executive's in charge, surely.
The executive. But I think we really would like to see, instead of what happened in September, was there was an emergency debate on the Thursday before they were due to go back. But I think they need to send out the right signals, and I think that would be a very strong and positive signal if those MLAs were back in their offices at Stormont on Monday the 10th of January.
Thank you very much, Gareth. Do you think that would be important, Felicity, or is that really sort of just for the optics?
Well, I mean, I think the thing is, when does the Assembly actually cease? Their elections are in May. You're probably more on top of the timetable than I am.
But the end of March, things go in,
Yeah.
they end at the end of
Further.
March to give a 6-week preparation period for the May election.
Exactly. So we actually don't have a lot of working time left, and doubtless they'll have a break at half term in February, like the English Parliament. So, I think, yes, the Speaker had said that a little while ago he was worried that a lot of legislation would fall by the wayside that's working its way through, because there's just not the time to get it worked through both the sitting of committees but also debates and so on in the Assembly. So yes, being in the private sector, I don't have long holidays. I have holidays when I can organise them, etc. But it's, I don't have 6 weeks paid leave. It doesn't exist if you're self-employed. So I'm always amazed at the length of time some organisations like the Assembly take off. And I would have thought, given the imperative of the election, even if we set aside the pandemic, because obviously the world continues anyway, of course they should be back and getting on with some of that quite important stuff. I think the Stoker legislation, for example, may not get through because there's not time.
Mm-hmm. Frances, a number of people are asking about lateral flows. What are you experiencing in terms of access to lateral flows? Because as we know, lateral flows are even more useful with Omicron than they were with Delta, because Delta is so infectious, it's a lot more detectable by lateral flows.
Well, it's my understanding that in Northern Ireland we're probably in a slightly better position in that there are adequate supplies of lateral flows, and they are getting out to the chemists now after the holiday period and should be available quite readily. We need to be careful just though. Lateral flows have a really good place, but we also need to be aware that there is a time and a place for getting a PCR as well, because lateral flows do not necessarily turn positive as quickly as a PCR. So if you're symptomatic, you must still get a PCR even though your lateral flow is negative. Where the lateral flow comes into its own is when somebody is actually positive and they need to then do their lateral flows on after day 7 to get 2 lateral flows negative 2 days apart, so that they can then come out of isolation at the appropriate time. And of course, lateral flows are very important. If you're going out.
Frances, we've had a number of people saying it is difficult to get lateral flows, and you'll have heard the pharmacy representative on Good Morning Ulster today saying how pharmacies have been struggling to get lateral flows. He says the demand is outstripping the supply and suggested that might be to do with transportation in getting those lateral flow kits to the pharmacies. So it is the case that a lot of people are struggling to get them.
My understanding as well was, obviously I'm not a pharmacist, but my understanding was that there was transport supply problems over the holiday. But I was led to believe that that's improving. But you've got to remember, and back to my point, that there is so much Omicron out there that all industry is affected, and drivers are and transportation is affected as much as everyone else. There are so many people who are off properly isolating because they're infected that are right across all our industries. We are compromised at the minute.
Did you say it was harder for lateral flows or easier to detect Omicron?
No, your lateral flow is can be positive, but it doesn't necessarily be positive as quickly as a PCR if you have symptoms. Lateral flows are very good at picking up people who don't have symptoms. But if you have symptoms, you must still get a PCR, because your lateral flow doesn't necessarily turn positive right away when you have symptoms. And you can be, falsely reassured that you're okay, only to find a day or two down the line, if you haven't got a PCR, day or two down the line, that your lateral flow does then subsequently become positive when you're already infectious.
Right, but the number of false positives or undetected is lower with Omicron,
yes, the number of false positives is lower. It's just that word of caution that if you have symptoms, you must get a PCR. If you have no symptoms, to do your lateral flow is absolutely appropriate.
So what do you think we should be doing then at this point, Felicity? If you're with Boris on riding this out, I think it's a phrase, isn't it? Ride this out, live with this virus. When it comes to the restrictions we have in place, look at some of them. Mask wearing, mandatory mask wearing in various places, and we've shut down the nightclubs, and we have other kinds of restrictions in place in Northern Ireland. What would you do about all of that?
Well, one of the things I would ask Frances as a GP is the stuff we talked about before Christmas, the change in the regulations about mask wearing, that a medical exemption must be provided now if you can't wear a mask. I was wondering, Francis, as a GP, have you got any guidance from the government about that yet? Because, well, there's some discussion as to when it actually becomes enforceable, thanks to our Justice Minister. But that really needs clarified for people, because there's some very frightened people out there who won't leave the house because they're too afraid of what's going to happen if they can't wear a mask and they're standing wanting to go into Tesco's. There's no guidance issued that anybody can see on the internet. So I would be grateful if she could help us on that one.
Francis?
Yeah, no, we haven't been issued with any guidance as to what categories is acceptable that people don't have to wear a mask. As I say, we would know that the vast majority of people, should be able to wear a face covering.
But they have lifted the exemptions idea, haven't they? That's the point Felicity's making.
Not just that you have to demonstrate why you were medically exempt is the term authorised.
And I think the concern, Francis, is that there were people who were saying, some people were saying that they had a medical exemption when there was no medical reason, no clinical reason why they shouldn't be wearing a mask.
Yes,
but the main issue is those who are psychologically unable to wear a mask, say as victims of sexual violence, who may not have spoken to her doctor or his doctor about it yet, and therefore nobody knows about it. And this person... So that's been lifted too.
And I guess the argument that they were making, I'll bring Francis in on this, is if you allow that exemption, anyone who just for, whatever reason doesn't want to wear a mask could simply say that at any time and walk away without a mask. And your whole mask policy falls to pieces. Francis?
Yes, I mean, it's something that's very difficult. And the problem is that the benefits of wearing a mask or a face covering are so massive. It really does work and help preventing spread. And I mean, it's very difficult to argue that there is a medical reason for not wearing it when it is such an important thing to do to help protect everyone around you. You could be infectious and not know it. And masks really do work.
03030 80 55 55. We're talking to our expert guests in their different areas. We've got Felicity Huston, who's a business expert, and Frances O'Hagan, who's a medical expert. Let's taking your calls as well. I think Andrew's there. Hi, Andrew.
Hey.
Hello, Andrew.
William. Hello, William.
Welcome.
William, as I said to your producer there, my wife works for the NHS. We actually went out for some date just after the New Year there to a well-known restaurant in the town, and I was absolutely appalled. The two people simply said us, we were social distance. My wife said, I work for the NHS. And the girl thought says, well, we don't believe in it. We're not double jobs. And she says, well, how did you get in? And they said, done a natural flow. So if you could do a natural flow to get into hospitality, what was the point of everybody getting double job boosted? Like, my wife and our colleagues are under that much pressure in ICU and everywhere at the minute. They're working their socks off and working long hours. So what's the government? Why does the government not do away with a lateral flow? You're not jabbed, you don't get in.
Well, we need the lateral flow, don't we?
Yeah, but why?
Well, because you've got to test in order to isolate people.
Yeah, but isolate, but don't do it to get into hospitality.
Yeah, but how do you isolate without knowing who's tested positive?
Yes, but William, it's getting into hospitality. You have to take a lateral flow to get in.
Oh, I see what you mean. You don't mean get rid of the lateral flows generally. You mean get rid of the lateral flow as part of the passport system to get you into premises.
If you're not double jabbed and you don't have the passport vaccination, you shouldn't be allowed into the nightclubs and the hospitality. It's an absolute disgrace.
But, well, would it not be the point that, as we know, and I'm sure Francis will confirm, three injections does not stop you being contagious? It greatly reduces your illness. It may reduce your chance of catching it and passing it on, but doesn't eliminate it. If you've had a negative lateral flow test before you go out, you're probably less likely to be carrying it than perhaps somebody with all the necessary vaccinations.
Well, you don't know that.
Exactly.
No,
we don't. Well, the people who have a negative lateral flow test are more likely not to have COVID. The statistics, as I said, I'm an accountant. I could spend hours showing you numbers that'll prove all sorts of things. But the point is, just because you have had 3 doses of a vaccine does not mean you can't be carrying and passing on COVID.
Of course.
I think we know that.
No, we do know that, but you're much less likely to contract it and you're much less likely to get seriously ill. That's the point of the vaccine.
But I'm talking about a lateral flow test. If you're in possession of a negative lateral flow test, we're relying on those as evidence that you don't have it and you aren't going to give it to somebody. So that's every bit as valid as 3 vaccinations.
Yeah. I think the point Frances made earlier was, Frances, you were saying you might have a negative lateral flow test and yet you have COVID.
Yes, and yes, you could have 3 vaccines.
And I think that's Andrew's point, isn't it? That if that's the case, then why would you allow a lateral flow test to get people in through a vaccine passport system?
Ditto, how many people have got 3 doses of the vaccinations and have COVID at the moment? Huge numbers. So it doesn't eliminate the risk.
But if they have COVID at the moment, then they shouldn't be going into a restaurant with a passport. They should be self-isolating.
They could be asymptomatic.
But that's why you test them. You test them to find out.
But no, not everybody going into we're talking about people going to restaurants here and similar. You either have your expected number of doses of the vaccine or you take a lateral flow test. The people who take a lateral flow test can at least demonstrate that they're more than likely not to be carrying COVID. The people who have 3 doses of the vaccine don't have to demonstrate anything, and they may be carrying it asymptomatically.
Right. I think it's important we always remind ourselves the use of the word mitigations, isn't it? I mean, none of the Felicity's absolutely right. None of these things prove black and whites, right? But they're mitigations. They simply reduce significantly chances, and that's as good as we can get, really, in a pandemic, isn't it? Mitigations. Here's a question on 81771. Can you ask Dr. O'Hagan? There's all this talk of getting out of self-isolation if lateral flow negative test twice. What happens after day 10 if you're still having positive lateral flow test results and a cough? Well, I think that's a reference, isn't it, to the system that started in England. So used to be there, you isolate for 10 days. We've got the system now down to 7, haven't we? 10 days, and the new system is if you test with a lateral flow negative on day 6 and 7, you can be released earlier on day 7. This person's saying, what happens after day 10 if you're still having positive lateral flow results and a cough?
William, the issue is that you can be released if you have 2 negative lateral flows 24 hours apart. If you're still positive at day 10, you go nowhere.
Yes, but
do not
I guess
until negative.
How long have you known people to actually stay in self-isolation beyond day 10?
Remember, it used to be 2 weeks, because it can be up to 2 weeks. The bottom line is you do your lateral flows, and if they're positive, you do not go out.
Don't go out.
Should that be day 7, 8, 9 and 10? I would also like to just make a point on your discussion a minute ago about going into restaurants with passports and triple jabbed and lateral flows. If you listen to anything that I had said before Christmas and before the New Year festivities, I was advocating, as were most of my colleagues, that even if you have 3 jabs, which is great, you should still do a lateral flow before going out, because your point was right, William. It's about mitigation. You cannot pick up every single person that is infectious. So you do your best with everything in your armoury to try and ensure you don't unwittingly go out and be carrying the virus.
81771, here's another one, no name on it, but it says, I'm just checking something. My daughter's 19, she tested positive on Christmas Eve, is feeling better and is negative now. So she's had a negative test. She didn't have her booster prior to Christmas. Is she still eligible to get the booster? I know the answer to this question because that was me. I was meant to get my booster on the day I tested positive for COVID. You have to wait 28 days from a positive PCR test before you're eligible for the booster. So that's the answer to that question.
That's correct,
but
William.
The good news for your daughter is that natural immunity is flowing through her, and that's a great thing too.
But she still should get her booster when she's in 28 days.
And can get it. I got mine subsequently, but I had to wait the 28 days. Somebody else saying it's great to hear some optimism from all sides. It's been a difficult 2 years. Felicity's attitude, though, this is Cahill, not me, Felicity. Cahill is saying Felicity's attitude comes across as patronising. As an adult, I do not need Robin Swan to smile. I just need him to be sensible and on top of things.
Fine, Cahill, it was a joke.
This Cahill is what she always does. Every time you call her out on a snide comment like that, it was a joke. Isn't that right?
Well, I mean, one of the things that's very necessary in bad situations is humour, because otherwise, Francis's psychiatric colleagues would be overwhelmed even more with clients than they currently are. We have to keep our sense of humour too. It was one of the things that kept people going through the war, kept going through, in the USSR, they had tremendous sense of humour to deal with what they were living with. We just have to have a huge sense of humour too. And I'm sorry, if mine's a bit dark and I'm sorry.
It's all right. No, it's okay.
That's just me.
We're all amongst friends here. We're all capable.
Well, clearly not with Cahill. He doesn't
I'm sure Cahill appreciates it. Cahill, it was a joke. And I love teasing her, so she can cope. Don't you worry about it. I'm just wondering, at some point along the way here, Felicity, in this journey of this year, if this is an optimistic year, if the World Health Organization and other experts saying this is the year we could beat this thing eventually, COVID will be circulating for years, of course, we know that. But in terms of the need for lockdowns, the need for restrictions, etc., this could be the year we head out of the exit gate. At some point, a big political decision will have to be taken about self-isolation, won't it? Because self-isolation is increasingly the biggest here around Omicron. People get infected with Omicron and they have mild symptoms, but they're not able to go to hospital where they work or any other places where they work for a certain number of days. We've reduced that from 2 weeks to 10 days, from 10 days to 7, and some places the movement from 7 to 5. At some point, self-isolation will have to go, won't it, as a strategy?
Well, I mean, I think of, was it 2018 was the last bad flu? Who remembers flu? And yes, that's a joke too. And, huge numbers of people were off sick. I mean, I had this horrendous flu. They had me propped up in the corner on Christmas Day, because I could do nothing. I mean, these things happen, and people couldn't go to work because they were too sick.
But there's no legal requirement on you doing what you just do. Use your common sense. You do what you think is right.
Exactly. You don't go out coughing. I mean, I always have hated the sound of somebody sneezing or coughing behind me in an aeroplane. I mean, the family laugh about the way I twitch when I see such a thing. It is rude. It is bad manners, and fundamentally there's a reason for that. And you don't go out if you're coughing, spluttering and feel sick. And I mean, with bad flu, you can't hardly get out of your bed anyway. So I think it will probably come back to that. I think there's a recognition that most people will take responsibility. We cannot legislate for every person, it just can't be done. People will do stupid things. They do. That's humanity. But most people will recognise that if they're not well, stay at home for a few days if you possibly can.
All right.
Don't give it to other people.
Here's a question from John in Bangor for Francis. If Omicron and subsequent variants don't lead to ICU admissions in great numbers or in numbers at all in 2022, if that were to be the case, why continue to vaccinate, says John?
Because the vaccination is the reason why
there you go.
We're not getting people in ICU.
Thank you very much. Orla's there too. Hi, Orla.
Yes, I just want to make several points there.
Go ahead,
First of all, I'd just like to pick up on something your guest Felicity said when she said that the virus spreads even between vaccinated people, and I'm sure your doctor will confirm this. We all know by now that although the virus may spread between those who are vaccinated, it actually spreads much less. So
say that. I missed that. Sorry.
Pardon?
I missed that. Sorry, say that again.
Although we do know that the virus still spreads between those who have been vaccinated, it does spread much less than it does between those who have been unvaccinated.
Got it.
So the whole purpose of the COVID passport, getting into clubs, pubs, nightclubs, and hospitality, etc., is to ensure that those who are vaccinated feel that they're in a safe environment. And secondly, it's also to incentivise uptake of the vaccine. That's why in the southern part of our country and indeed in Europe, they have not gone for lateral flows as an either or with the COVID passport. You must have the COVID pass to get into all indoor venues. And that's the only way you will actually increase the vaccination rate and also drive down the infection rate.
Thank you very much, Orla. So vaccination, as we know, is a way in which you can protect yourself. And we still have larger numbers of people who are not vaccinated across the UK. And we have a disproportionately high number of people in need of hospital care and ventilators and ICU and all the rest of it, Francis, who have not been vaccinated or boosted.
Yes, I mean, your caller is quite correct. Most of the people, I mean, as the leader in USA said, this is the pandemic of the unvaccinated. Well, really, this is the ICU pandemic of the unvaccinated. And it is predominantly people who are unvaccinated who are in ICU, which is very sad because it's so preventable. And as well as that, your caller is correct. People who are vaccinated are less likely to spread the disease and less likely to catch it. So that is why the COVID passport has been implemented in the way it's been implemented in several other countries. But I still believe that we should use everything at our discretion, everything in our power. And there's no reason, even if you're vaccinated, you can't do a lateral flow if you're going out to, out to hospitality or out to where there's a lot of people in enclosed spaces.
Thank you very much. Really appreciate it. Always good to talk to you guys. Really appreciate it. Dr. Frances O'Hagan and Felicity Huston, the